Late Night Health continues. During the next hour, we're going to talk about allergies and also weight loss. So if you don't get us on your local radio station, be sure to go to latenighthealth.com, latenighthealth.com. We are spending some time with Rinaldo Burtoco, creator of Aloe Cadabra and Dr. Laurie-Steelsmith, nationally recognized naturopathic physician and the co-author of Great Sex Naturally. We have a couple minutes to spend. If you want a free tube, by the way, of Aloe Cadabra, you can call 866-961-2563. Be sure to put in or say late night as your code, and that way you'll get the free tube of Aloe Cadabra. You can also go to allocadabra.com. Sex is a part of life. It's a private part of life. People don't normally talk about their sex lives. But is sex really important to most people? Even as they're growing older, they want to continue that intimacy? Dr. Steelsmith?
Oh, people absolutely want to continue with that intimacy. It's an important part of life, of bonding and nurturing each other and showing love and affection, and it brings stress levels down. It's a very important part of life.
Why do we think that old people don't have sex?
Oh, because they might not be able to move as easily.
Okay.
And I think that, it's a part of our cultural conditioning, and that older people do have a lot of intimacy in their lives and a lot of sexual interaction.
I think, Mark, it's also from my experience, which is far more limited than Dr. Steelsmith, but from the people I've talked to over the years, we were creating the product and getting it out there, a lot of the hormonal levels change. So for men, their testosterone goes down and they're less interested as they age. For women, I think there's a huge percentage. I'm going to guess that 50% of women over the age of 55 experience some discomfort a good part of the time from intimacy because of vaginal dryness. Now, vaginal dryness can occur when you're in your 20s after you've just given birth to a child or some traumatic event, post-surgery. So it's not exclusive to women who are peri- and post-menopause. But when you are in that category of peri- and post-menopause and beyond, the odds, and maybe Dr. Smith would know, Steelsmith would know, what are the percentages likelihood that you're experiencing discomfort, and that's what's keeping you from intimacy?
That's a very good question.
I don't know the exact percentages, but I can tell you that I would tell you, honestly, that probably more like 99 to 100% of my patients post-menopause are experiencing either dryness or vulvovaginal atrophy, which means thinning of the tissues. Estrogen supports not only the vulva, but the vagina, the urethra, and the connective tissue of their pelvic floor. So when women are experiencing lower levels of estrogen, these tissues can become dehydrated and thin and atrophic. And women are more prone to bacterial infections in the vagina, yeast infections, as well as bacterial infections in the urethra, which can lead to a urinary tract infection. And sometimes women stop having intercourse because every time they have sex, they get a urinary tract infection, and they have to take antibiotics, and they get on this whole merry-go-round of having to take antibiotics and getting a yeast infection.
And that's why, Rinaldo, that's why you created the product for your wife. She was having
exactly what we said last week,
right.
Dr. Steelsmith. That's what my wife was on, and it was a yo-yo, as you just said.
Yeah.
And it was just driving us both crazy, and we love each other a great deal, and although sex is extremely important, as it is, any loving couple has been married we're at 32 years now.
You're just starting, Rinaldo.
Yeah, but it's 33 years. We have a lot more in our relationship than sex, obviously, but that was really becoming such an enormous focus for my wife, and she was confused, she was in pain, she didn't like having to go to the drugstore and getting these terrible drugs. We didn't know what was going on, and we thought it was just us at first. And then we realized it was this huge epidemic-level problem.
We only have a couple minutes left, and I don't mean to interrupt, but I wanted to say that the Aloe Cadabra people have made a huge donation to Planned Parenthood. Can you give me a 20-second synopsis of that, Rinaldo?
Yeah, we were approached by Planned Parenthood in Southern California, and we've made a donation of $100,000 worth of Aloe Cadabra so that the patients who go to Planned Parenthood need financial assistance. And they've been getting condoms, but they've been getting it with lubricants that are not healthy for these people.
Hey, thank you very much, both of you. Listen, we're giving away a free tube of Aloe Cadabra. Call 866-961-2563, 866-961-2563, or go to allocadabra.com. Enter the promotional code Late Night, and you get a free tube. Okay? You can't beat that. Listen, Dr. Steelsmith, thank you very much for joining us. Rinaldo, it's always a pleasure. I look forward to talking to you both again. Dr. Steelsmith will be back with us next week. I'm Mark Allen. Late Night Health continues, and join us at latenighthealth.com. latenighthealth.com.
You're listening to Late Night Health with Mark Allen. The show continues in a moment.